Hello, this is Bryant Myers, author of PEMF, The Fifth Element of Health. I'm going to do a little video here on PEMF therapy for pain relief. And this is some new information that I've got lately, and I'm really excited to share it with you because pain relief is still, as far as I know, the #1 reason that people get a PEMF therapy device. And I just want to say before we get into this that I'm doing free consultations now. If you're in the market for a PEMF device, feel free to give me a call at 941-928-0124. So let's get right into it here now. PEMF therapy is the best tool that I know of for pain relief. And I just want to kind of introduce you. Most people that are watching this probably know what PEMF is, but PEMF, or pulsed electromagnetic fields, are magnetic fields that change with time. And they are natural and all around us. The Schumann resonances in the Earth's magnetic field has a frequency component to it. PEMF devices now are basically electromagnets that have a signal generator. So you can basically take a magnetic field and you can modulate it into different waveforms. And this, as they found in the late 70s, early 80s in the Eastern European studies, it works better than just static magnets. Now, PEMF therapy got a lot of popularity after Dr. Oz show on PEMF therapy for pain management. And Dr. Oz said it was one of the greatest breakthroughs in pain management he had ever seen. And I have to agree with you, as I've had many testimonials just myself, not to mention hundreds of people that I've worked with. Now, pain is an epidemic. 116 million Americans are suffering with pain, and that's more than cancer, heart disease, diabetes, and a lot of the top diseases combined. So obviously this is an epidemic. That's a staggering percentage of Americans. So there's many sources for pain, but certainly it's one of the main complaints that people just have in life. And being free of pain can be just such a blessing for those that have experienced it for so long. And I have seen literally in the hundreds of testimonials over 15 years on how PEMF therapy helps for pain relief. So what is pain? Pain is basically an unpleasant sensory and emotional experience that results from some injury or some trauma or something that happens to the body. And the most common forms of pain, as we mentioned, is chronic acute. Acute pain is like if you hurt yourself, like right away you feel the pain. You know, you put your hand on a stove, you feel the pain instantly. So how do we sense pain then? So basically, when you have an injury or something happens, the first thing that happens, let's say you put your hand on the stove, is the nociceptor nerves are nerves in your body that can detect damage. And then they will send a pain signal up through your spinal cord to your brain. And then typically the first thing that the brain will say is take your hand off the stove. But after that, there still is, and we're going to get into this in this video and how PEMF helps, there's still a lot of other things that happen. So once you injure yourself, there's a whole cascade of an inflammatory type of cascade, which inflammation, as we'll see, is a good thing in moderation because you do need it to start to heal the injured area. Now, in my last video on pain, I really went into this whole opioid epidemic, so I'll put a link below. And but just to update it, now there's recently the highest deaths to date due to opioid type of overdoses or addictions. Over 80,000 just very recently, I think 2022. And a lot of this got worse during the pandemic. So it's not getting better, it's actually getting worse. So since my last video I did on pain a few years back, the whole situation with the opioid crisis has gotten worse. And I just want to kind of go over this chart here because the main culprit in these opioid addictions is the synthetic opioids. This is the total number of deaths here. And you can see the synthetic opioids, especially fentanyl, are the leading contributors. And it's kind of three waves with this opioid epidemic. The first wave was back with Purdue Pharma creating Oxycontin in the 90s. And again, this is, when you really look into the history of that, it's kind of upsetting because Purdue Pharma said this, look, we've discovered some non-addictive pain reliever. It's just wonderful. But it turned out it was incredibly addictive, as addictive as heroin, actually. And so that kind of was the start of this opioid epidemic. You know, doctors prescribing these Oxycontin, when later on came Percocet and Vicodin. So this is not a good solution for pain. Yes, in extreme situations, when people are under a lot of pain, and even for like cancer, you know, fentanyl is something that doctors can prescribe. and for cancer patients usually are for like extreme pain situations. But too many people are reaching for opioids with situations that are not nearly as bad as that. And something like PEMF therapy can help without needing to have all these addictive solutions. And not only addictive, but they don't help to fix the problem, and they cause damage themselves. Opioids, the opioid deaths are usually due to breathing, because opioids will, amongst others, there's many side effects, but the main one is just trouble breathing. So respiratory failure is one of the main things that happens to people that overdose on not just the drugs, but also fentanyl and the heroin as well. So conventional medicine typically, will start with aspirin, Tylenol, Aleve, and then if that doesn't work, then we'll go to the stronger opioids. And if that doesn't work, or sometimes instead of the opioids, doctors will give a steroid injection to the local area. Problem with steroid injection is they have a lot of side effects too. One of them is it actually destroys tissue. And you can end up with these pock marks, which is basically tissue that just kind of melts away. I mean, this is not good. This is why steroid injections, you can only get a limited number, because it does damage the tissue. So it's just only a temporary solution, and it's anything but helping the body to heal. All it's doing is it's just getting rid of the pain. And then if none of these works, then there's surgery, procedures, implants, and they even will do operations on the brain and spinal cord just to cut the pain off. But this is incredibly invasive. So, and then, physical therapy typically only helps with acute situations. So we need a better solution for pain, a much better solution. And to me, as I said many times over the past 15 years, PEMF is that solution. And, PEMF therapy does have a lot of research, over 30,000 studies. It's FDA approved for pain, swelling, depression, brain cancer, non-union fractures, and many other things. And it's being used by NASA. There's really good NASA research, Dr. Goodwin, and in the Russian space program also, they used it in like the Mir space station and different long-term. So very well established. And the two studies I kind of want to highlight here is one by Alex Thomas at the Lawson Research Institute. And he did a randomized double-blind clinical trial study, and it was low frequency and low intensity. Again, more is not better, as I've said many, many times over the years, and there's good research for that. But so he used low frequency, low intensity, and he compared PEMF to popular opioids. And what he found was PEMF therapy had the equivalence of a low dose of morphine, which is about 10 milligrams. I mean, it's just amazing. So literally, PEMF works as good as these opioids, at least a low dose for pain relief. But as we'll see, it also helps with the healing and regeneration process. And the other study I want to look at, and again, this shows PEMF. I picked these studies because they correspond to the two main treatments for really severe pain, which is opioids and steroid injections. Now, the other study by Kaz and Zunka and Murat Bertain did a study also in 2007 on the effectiveness of PEMF for epicondylitis or tennis elbow, just known commonly as tennis elbow. And what they found, just to summarize the research, was that PEMF actually worked better than steroid injections, again, without all the side effects. So before I get into the mechanisms of how PEMF helps, let's look at all the different steps on what the body does once let's say you cut yourself. So let's say you cut yourself. What happens is, first there's an ouch. The nociceptor, the nerve cell, sends that signal to the brain, and you feel pain. It hurts, right? So after that happens, now very, very instantly, a whole inflammatory cascade takes place with hormones and signaling molecules. All your immune systems migrate to that spot, typically, mainly macrophages and neutrophils. The problem is with chronic inflammation is these inflammatory cytokines, they don't stop getting produced, and the inflammation just keeps going and going and going. So basically now PEMF therapy is helping with all of these steps in the injury process. So the first thing it does is it calms the nociceptors. Because again, it's sending this pain signal, and those nociceptors are the injury detecting nerves. So if there's an injury, they're going to be all agitated and firing these signals. So PEMF helps to calm that, which then helps to smooth out that pain signal and lessens it. PEMF therapy stimulates microcurrents. This is why you want a rapid rise and fall signal, because those microcurrents will interrupt the pain signal altogether. So that's a signal going from the nociceptor to the brain. The PEMF can interrupt that signal, and less signal equals less pain. PEMF therapy increases endorphins and enkephalins. So these are your body's, again, natural opioids. And they will bind to opioid receptors in the brain, and that blocks the pain signal. But then it kind of gets more exciting because then PEMF actually helps with the anti-inflammatory. So it helps to create more anti-inflammatory cytokines, which then kind of trigger the M2 macrophages to sort of release these and turn the inflammation off. It's like a switch, M1 and M2, from inflammation to anti-inflammatory. So inflammation is needed for a time to get everything in there to heal. But once everything's healed, you don't want the alarm to keep going off. So PEMF it's been, again, research proven to increase these natural, anti-inflammatory cytokines. It's just absolutely fascinating to see the body's just near infinite intelligence and how it heals itself. And when you give the body an energetic boost from PEMF, then the miracles really happen even more efficiently and quickly. So like I said, it fixes the problem. And some of the things that it does, that PEMF has been shown in research to do, is increase ATP and energy. This is one of the main things PEMF reason that it helps for just about everything. Because when you have more ATP energy, your cells can divide. I mean, all the things that you need to do to heal and regenerate need energy. So by increasing energy and the microcurrents as well, you're able to stimulate the regeneration. The stem cells, again, the NASA study and other studies showed that PEMF increases stem cells. And through the increased voltage, it helps the cell division because, for cells to divide, they need more energy. And again, when you're making new tissue, you need more cells. And finally, better sleep. This is kind of sometimes underrated as one of the benefits of PEMF. And it's the first thing I noticed when I first started using it. And it absolutely helps with better sleep. It's one of the most important things PEMF therapy does. Now, to get all of these benefits, you want to make sure you have a good PEMF therapy device. And I'm not going to go through it all again, but I did a 2023 buyer's guide video, and I'll put the link below, and there'll be a little button above here. Please do watch that video so you get a good PEMF therapy device, because there are some really bad ones on the market and they may not give you these wonderful results. So to get the best results possible, start by drinking a glass of water before each session. That's important. Of course, it does help to eat a more alkalizing diet and an anti-inflammatory diet. There's some good books out there on foods that are inflammatory versus anti-inflammatory. So you really want to avoid those inflammatory foods. Now, I do recommend a PEMF device with a full body mat to kind of get all those channels open. Again, this whole healing process is a whole cascade. The best combination is a full body mat plus the local applicators. And while you're on the mat, practice some deep breathing. We found that really, really helps. And like I said, use the local applicators on those specific areas. And there's really no time limit with local applicators. So I sometimes will do like 2 hours if I hurt myself. If it's arms, legs, low back, and hips. If it's the torso or the head and neck, you probably want to limit it to half an hour. I do like red light therapy. So if you have a red light therapy device, to me, it's a 1 + 1 = 3. So you can definitely do both. Supplements, enzymes, bromelain, turmeric, curcumin, magnesium, collagen, MSM, vitamin D, vitamin C, astaxanthin, resveratrol. A lot of good antioxidants, anti-inflammatories. The systemic enzymes are great because it can break down the scar tissue when your body creates too much scar tissue, like little Pac-Men that go in there and also help with the rebuilding. Smiling and laughing more, again, that creates more endorphins. Norman Cousins wrote a whole book on that with his disease, and he relieved his pain by just laughter. And so, try to go out of your way to find some things that make you laugh. And this might seem obvious, but I tell people just use it regularly. Even for prevention, it's called preconditioning. If you use it every day, you're going to heal and regenerate more quickly if you do hurt yourself, or maybe not even get injured at all. So prevention is the best idea, but even if you have a chronic condition, do use it every day, because sometimes the results take time and you have to be patient in some cases. Combine it with massage and chiropractic is always good. I do like to walk barefoot, get grounded. That helps. That's also anti-inflammatory. Meditation, relaxation. anything that can help you to get more relaxed is going to help. So that's really all I had for this video, and I hope you liked it. Do like and subscribe. Leave some comments below. If you'd like a free consultation, like I said, give me a call, 941-928-0124. And thanks for watching, and have a great rest of your day.